I am Dr. Saqib Mansoor, and this is my channel, Learning Anatomy. And today I will discuss with you the anatomy of the eyeball. Yes, here you see this is the anatomical structure of the eyeball. We're going to discuss with you in detail now very soon. And I will tell you the contents of the orbit. These are eyeball and the extraocular muscles. And this out of these two contents of the orbit, today I will discuss with you the eyeball. And the extraocular muscles I will discuss with you later on. So the shape and location of the eyeball, its shape is spherical. Location, of course, I told you already, it is within the orbit and its size is approximately 25 millimeter in diameter. And the socket for support of the eyeball is the facial sheath of the eyeball or the bulbar fascia or tenon capsule enveloping the eyeball. Layers of eyeball. So you see it is made up of three coats enclosing three refractive media. So these are the three coats, 1, 2, 3, and this is the refractive media 1, 2, 3. And the coats are, first I read it for you, then I will demonstrate and show you in this beautiful picture. This is really amazing. You see the first coat is a fibrous coat, which is consisting of sclera and cornea. And the second coat is the vascular, which is also called as uvea or the uveal tract, consisting of the choroid, ciliary body, and the iris. And the third coat is very important, neural, also known as the retina. And the refractive media consists of the aqueous humour, the vitreous body, and the lens. So let me enlarge the picture for you with the zoom. So yes, here you see with it, this, outermost coat, the fibrous coat, this is the sclera, this yellow, right? You see, going here, from here to here, this is the sclera. And this anterior part is called as this cornea, right? This is bluish, right? This is the light yellow. This is sclera and this is the cornea, right? This is the outermost fibrous coat. And as we move just inside the sclera, this is, we have the choroid, right? This is the choroid, and this choroid, as it goes on, there is a ciliary body, right? And this is the third part, which is the colored iris, right? These three parts, right? So these are the second coat, and the third coat of the eyeball is this retina, the innermost coat. This is the retina. Here you see, this is the retina, right? These are the coats. And then I tell you about the refractive media. So first, this is the, you see the red laser, this is the aqueous humor, right? And this is the vitreous humor. And in between these suspended is the this lens, right? These three structures form the refractive media of the eye. As the light enters here, it is bent by these media. Also involved in the refractive media is this cornea, which rather plays the most important role in this as the refractive media. So the coats of the eyeball in detail. So first of all, of course, this is the fibrous coat. Anterior part is transparent cornea. So cornea, this transparent part, you see the red laser, this is transparent and this is avascular. Cornea doesn't have any blood supply of its own. So posterior part is opaque, right? This is the sclera. Yes, here you see this going this. And cornea and sclera are continuous at the sclerocorneal junction. Let me enlarge. You see, you go here. Yes, this is the sclera and this is the cornea. And here would be this junction. This is the corneoscleral junction. So, or the sclerocorneal junction. Sclera is a tough fibrous membrane that maintains the shape of eyeball. and it provides insertion to the extraocular muscles, right? They are inserted onto the sclera. So sclera is continuous posteriorly with dural sheath of optic nerve. This is sclera, and posteriorly, you can enlarge for you. Yes, here. This is the optic nerve. You see the labeling. And this is sclera. So it is continuous with the dural sheath of the optic nerve. And the point to be noted is that the optic nerve, unlike other nerves, is enveloped by or ensheathed by the three meninges, right? Three meninges. So this is the thing, and posteriorly optic nerve pierces sclera 3 millimeter medial to the optical axis at the posterior pole. Here you see, this is the piercing of the optic nerve, right? It pierces the sclera 3 millimeter medial, right? This is the point, which is the optical, the visual axis, and 3 millimeter medial or nasal to that, it pierces the sclera, optic nerve. Here it is piercing it. So one other word for you, corneal limbus. This is the angle. This is the limbus, and it will enlarge you very soon. This is the limbus. I will enlarge. This is the angle formed by the intersecting curvatures of the sclera and cornea at the corneoscleral junction. It includes various capillary loops responsible for nourishment of the avascular cornea. So I told you this is the point where the cornea derives its blood supply from. So let me now enlarge it for you. So you see, this is the limbus at the corneoscleral junction, this angle formed over here. So fibrous cord continues. Cornea is extremely sensitive to touch. Its nerve supply coming from the ophthalmic nerve, part of the cranial nerve, trigeminal, and first part, ophthalmic nerve. Even tiny foreign bodies, for example, dust particles, bring about blinking, lacrimation, and at times even severe pain. When corneal surface get dried, it can lead to ulceration. It does happen, for example, in Bell's palsy. I told you already in my lecture on the muscle of the facial expression. It is with the picture, help of the picture, Bell's palsy. So now the very important vascular coat. This is made up of choroid, ciliary body, and iris. Told you already. This is choroid. This is the ciliary body, and this is the iris. So choroid is divided into 3 layers. First layer is the suprachoroid layer. It contains connective tissue fibers and numerous melanocytes. Vascular layer contains numerous blood vessels and melanocytes, and choriocapillaries layer contains capillaries with large lumina. Innermost layer of choroid is glassy membrane and lies adjacent to the pigment cells. Pigment cells separate choroid from retina and perform important functions. So you see there is the melanocytes containing melanin, and so the choroid is responsible for the dark color of the eyeball. So posteriorly, choroid is pierced by optic nerve. Here you see, this is the optic nerve also. It pierces the sclera and also the this choroid. Anteriorly, the choroid is connected to iris by the ciliary body. This is the ciliary body. It nourishes the retina and darkens eye. I told you darkens eye, and also it provides blood supply to the retina, which lies, adjacent to it and below it. Talking about ciliary body, very important. This is a ciliary body. You see my red laser moving on, ciliary body, right? It consists of very important ciliary rings, a fibrous ring continuous with the choroid, right? This is the choroid, and here this is the ciliary ring, and it is continuous with the choroid. And the ciliary processes, there are approximately 70 folds, about 70 folds arranged radially between the ciliary ring and the iris. This is the ciliary ring, and here is this is the iris, and these are the processes. They are connected posteriorly to the suspensory ligament of the lens. This is a suspensory ligament. Yes, this. And now I will show in a zoom form. Yes, here you see, right? So this is the choroid. You see the labeling. This is the darker yellow. This is choroid. And this is the ciliary body. Here the this is the ciliary processes, about the 70 folds. These folds are the ciliary processes, right? And they're connected anteriorly here with the iris, and they are posteriorly connected with the this suspensory ligament. Or this is labeled over here, suspensory ligament, or the zonule, right? Attached to the lens via this suspensory ligament, this ciliary body. So the ciliary muscles, outer radial and inner circular layer of smooth muscle responsible for changes in the convexity of the lens in accommodation. I will tell you in the end what is accommodation. So iris, look, a few words about the iris, right? This is the iris. This is the colored membrane suspended in the aqueous humour, right? This is the aqueous humour. See the razor? And right, this iris, it is behind the your cornea. This is the cornea, and in front of the lens. In its center is a circular aperture pupil for transmitting light. This is the circular aperture light of called a pupil, and it transmits light. This cap is the pupil connected to the circumference of the ciliary body. You see this, I told you already, this is the ciliary body and iris is attached to that. So iris, and I have to tell you the ciliary muscles, right? Two involuntary muscles are responsible for controlling the size of the pupil. So first of all is the dilator pupillae over here, right? So the fibers are radially arranged, right? You see, these are the radially arranged fibers, and it is sympathetically stimulated. So of course, a radial fibers, so they will dilate the pupil, right? This is the thing. They are the postsynaptic sympathetic nerve fibers. And here you see these are the circularly arranged sphincter pupillae muscle, right? They are circularly arranged and they are parasympathetically stimulated. They decrease the size, the diameter of the pupil, and so this is the constriction. The constriction is called as a pupillary miosis, and the dilatation is called clinically as a pupillary mydriasis. So iris is composed of 4 layers: anterior mesothelial layer, second layer is a connective tissue or stroma, connective tissue stroma containing pigment cells, and third is the smooth muscle, dilator pupillae, I told you already, radial, and the sphincter pupillae, circular. And the fourth is the posterior layer of pigmented cells. And here we go, neural layer, very important, retina. Here, innermost layer of the 3 coats, the innermost coat, this is the retina. So this is the expanded termination of the optic nerve, right? This is, yes, you say. And it consists of an outer pigmented and an inner nervous layer, outer pigmented and inner nervous layer. It lies between the choroid and the hyaloid membrane of the vitreous body. So you see this whole thing, you see the my laser, and this is the this whole thing. This is the vitreous body, and this vitreous body is limited by this hyaloid membrane, right? This white thing. And enlarge for you. Here you go. Yes, there, just there. This is the retina. This is the mauve color, and this white color you can see the hyaloid membrane. And this is a vitreous body. This whole thing, right? This is the vitreous body. As this was the anterior chamber, and that contains aqueous humor. And here you see this is the vitreous humor or the vitreous body. So anteriorly is an irregular edge called the ora serrata. Here, this is the serrated edge, right? This is the serrated irregular edge called the ora serrata. Posteriorly, the surface nerve fibers join to form the optic nerve. This I told you, retina posteriorly forms this optic nerve formed by the ganglionic layer, ganglionic cell in that. So retina, inner surface of retina contains macula lutea. You could see this, situated at the posterior pole on the optical axis. Yes, here. This is the optical axis. You see, this is the white thing, optical axis, the visual axis. And here at this point, it lies the macula lutea, the yellow spot, and situated at the posterior pole. And macula lutea, I told you already, it's a small oval area which has special photoreceptor cones that is responsible for acuity of visual, right? Acuity of vision, visual acuity. So it is not visible with an ophthalmoscope. Ophthalmoscope is a device used to view the interior of the eyeball through the pupil. Just over here, right? I should enlarge that. So macula isn't labeled over here, right? This should be the yellow spot, and its center contains a depression which is called as fovea. Let's see, fovea centralis. It's a depression in the macula over here. I'll show you in a large form already. It is composed of closely packed cones. It is devoid of rods, no rods present here. It is the area of most acute vision. So fovea centralis is approximately 1.5 millimeter in diameter. Center of fovea centralis is called foveola. Here, this is a fovea and its center is called as foveola. So a few words about the optic disc. It lies medial to the macula. This is macula, and medial or nasal to it lies the optic disc. So now let me enlarge. This is the optic disc. This is optic disc, this portion, right? Or the optic papilla, right? This is tell you, this is a lamina cribrosa. This is a mesh-like structure that supports it, right? Close to the optic disc. This is lamina cribrosa, and this is the optic disc, right? So here at the optic disc, optic nerve enters. Optic disc is insensitive to light as it has no photoreceptors. It is devoid of photoreceptors. As a consequence, this part of the retina is commonly referred to as the blind spot, right? This is very important thing. This is a blind spot. Why? Because there are no photoreceptors present here. So this is the blind spot, the optic disc. So central vessels of the retina coursing over the optic disc. Over they course over here. Central vessels of the retina, central artery of the retina, very important. It's an end artery. It emerges from the optic disc and divides into upper and lower branches. For example, dividing into a nasal and a temporal branch. It's a branch of the ophthalmic artery. And as told you, this is an end artery. If it is blocked, for example, in diabetes, right? So that would result in blindness. So one thing I have to tell you, what is an ocular fundus? From clinical point of view, internal aspect of the posterior part of the eyeball, where light entering the eyeball is focused, is referred to as the fundus of the eyeball, the ocular fundus. It is made up of these things constitute these things constitute the ocular fundus. First is the retina, then is the macula, then is the optic disc, then is the fovea, and then are the blood vessels. Collectively, these things are called as the ocular fundus. Then cones and rods. These are present in the outer neural layer, and they obtain nutrients from the capillary lamina of the choroid or choriocapillaries. It contains very fine vessels of the inner surface of the choroid. A system of veins correspond to the arterial system and unites to constitute the central vein of the retina. So few words about the rods and the cones. Rods are about 120 million in number and are most numerous, approximately 0.5 centimeter from the fovea centralis. They contain a rhodopsin, a visual purple pigment, specialized for vision in dim light. So rods are responsible for dim light vision. The cones, they are 7 million in number and are most numerous in the foveal region, right? I told you already. Associated with bright light vision, visual acuity, and color vision, contain the visual pigment iodopsin. The visual pigment here is the iodopsin. So the optic nerve carries sensory fibers from the retina. We're talking about the nerve line, and the ciliary nerves carry autonomic fibers to the muscles of the iris and the ciliary muscles, and sensory fibers from the conjunctiva. The long ciliary nerves carry sympathetic fibers and arise from the nasociliary nerve. The short ciliary nerves arise from the ciliary ganglion and carry postganglionic parasympathetic fibers. So now we'll talk about the refractive media. So first of all, of course, this is the, I told you already, this is of refractive media is refractive media. First of all, this lens, then this aqueous humor, and this is the vitreous humor. Lens is biconvex. You see here, this is convexity and this is convexity. This is enclosed in a lens capsule, lies between the vitreous and the aqueous humor just behind iris. I told you already, this is iris. Surrounded by a suspensory ligament connecting it to ciliary processes. This is the lens, this is the your sensory ligament over here you see, and it is connecting it to the ciliary processes, right? So aqueous humor, filtrate of plasma secreted by vessels of iris and ciliary body into space between lens and iris. This is the posterior chamber of eye. It will now have to enlarge the picture to show you the chambers. This is, you know, the posterior chamber. The aqueous humor is secreted over here, right? This is the posterior chamber, and as it is secreted from here, it travels over here and across the pupil. It goes to the anterior chamber, right? This is the circulation of the aqueous humor. So reabsorbed, the aqueous humor is reabsorbed into ciliary veins via canal of Schlemm, sinus venosus clari. So again, I will enlarge for you. This is the canal of Schlemm over here for reabsorption. And the vitreous body, this is here the vitreous body, occupies posterior 4/5 of eyeball. This is a large portion, 4/5. It's a soft gelatinous substance called vitreous humor present within the hyaloid membrane. This is the hyaloid membrane, I told you already. Here, this would be the hyaloid membrane here, like this, right? See the red laser. And the hyaloid membrane passes forwards in front where it is thickened, receiving the attachments from the ciliary processes and giving rise to the suspensory ligament of the lens. This is the suspensory ligament, right? You see, this is the continuation of the hyaloid membrane, and here it thickens to form the suspensory ligament. I showed you already the enlarged form of the ligament, but you see again, this is the labeling, the suspensory ligament of Zanule. So here, over here, and this is showed you already, this, right? The hyaloid canal containing lymph passes forwards through the vitreous from the optic disc as far as the capsule of the lens, right? This is the optic disc, and from here the hyaloid canal, not shown here, it traverses this whole vitreous body and reaches the lens. Refractive media and compartments of the eyeball on their way to the retina, light waves pass through the refractive media of the eyeball. And here I have to include the cornea. Aqueous humor, lens, and vitreous humor all showed you already, in the cornea. Cornea is a primary refractory media. This is the primary refractory medium of the eyeball, implying that it bends light to the greatest degree. I told you already, focusing an inverted image on the light sensitive retina of fundus of the eyeball. So humor is removed by the limbal plexus, a network of the scleral veins close to the limbus, which in turn drain into both tributaries of the anterior ciliary veins and verticose veins. So what is the IOP, the intraocular pressure? It's a fluid pressure inside the eye. It is a balance between production and outflow of aqueous humor. So if the pressure is increased, that will lead to glaucoma. So the ciliary muscle of ciliary body is responsible to change the shape of the lens. When there is no nerve stimulation, the diameter of the relaxed muscular ring is larger, the lens suspended within the ring is under tension as its periphery is stretched, causing it to be thinner, that is less convex. The less convex lens brings more distant objects into focus, that is the far vision. So this is a mechanism of the far vision. So as the near vision is required, that is the parasympathetic stimulation is brought about by the oculomotor nerve, which causes sphincter-like contraction of the ciliary muscle. The ring becomes smaller and tension on the lens is diminished. The ring becomes smaller and tension on the lens is diminished. The relaxed lens thickens, become more convex, which brings near objects into focus. That is the mechanism of near vision. So, in the last few words about accommodation, what is that? It is the active process of changing the shape of the lens for near vision. This is accommodation. And what is presbyopia? The thickness of the lens increases with advancing age, with the result that the ability to accommodate typically becomes diminished after age 40. And cataract. Cataract is a cloudy area in the lens of the eye that leads to a decrease in vision, right? Cataract could be due to an advancing age or due to the diabetes. So this is a summary just for your entertainment sort of thing. Just you see the whole lecture is summarized on this page, right? This is the thing, right? All the things, all the layers. This is a brief summary. You can take a screenshot, save it, see the lecture again. If you have to revise it, right? This is optic days, blind spot. So I have made myself this summary and presented for you. So I thank you very much for listening to the lecture. I request you to do subscribe my channel and comment down below and like and share. Thank you very much.